Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the COVID-19 pandemic. And again, while we're starting to get really good news, the president's talked about the increase in vaccination that's going on. J&J was improved last week and is now being distributed, shipped throughout the country, including in our region, into Pennsylvania. And the governor eased some restrictions this week, which I certainly think is very appropriate. However, we've been down this road before, and I like to say this is our third time, and I don't want the third time to be a charm. Back in June, when we went into the green phase, people relaxed a little too much, and we saw our cases explode. And in July, we had to make some actions that we didn't want to do, but needed to be done. And then we solved that through July and August and even into September. And then in October, again, we relaxed and things got out of hand. And we had a very, very bad November and December and January. And then again, restrictions were put in place, and now February seems to be much better. March seems to be moving in a good direction. But Dr. Bogan will talk about that the numbers are starting to tick up just a bit. So when we have people that are irresponsible, like the governor of Texas and other governors who have just gone 100% open up, we're not there yet. Hopefully in a couple of months, when more and more people get vaccinated, we will be there. But what's been great about this region is the level of cooperation, people following our medical experts and taking their advice. And I know Dr. Bogan's going to give the weekly update, but we're getting there, and we're getting there in a good direction, but we still have a way to go. So, Dr. Bogan.
Thank you, County Executive. Good afternoon. Thank you for joining us. Our case counts in Allegheny County are no longer declining, but they are relatively stable. This week, our 7-day rolling positivity rate is 5.9%, a small increase from last week's 5.5%. Similarly, the 7-day rolling daily case counts is about 170 a day, a small increase from last week's 155. Hospitalizations and deaths continue to decline. Our case investigations, combined with this leveling off of cases, does worry me just a bit. We have again started to hear that sports teams are having social gatherings, people are hosting parties, and some reports indicate a lack of mask wearing and lack of physical distancing. So as I said last week, we are so close to being able to safely hold such events again, but not quite yet. Just a couple more months. If we aren't careful, we will have another surge of cases, hospitalizations, and deaths. Our experience over the past year tells us that we can reduce the threat of the virus by taking very simple steps. Wearing your mask, remaining physically distant, and washing your hands. You've heard it before, but it remains true today. We also know that more and more neighbors, particularly our older neighbors, are receiving vaccines, which is fantastic. Frequently, individuals write to us about their experience at one of the health department's vaccination clinics and events. For example, last week, 2 individuals in their 70s who had received both doses of the Moderna vaccine in our Monroeville clinic wrote to express their gratitude, knowing that they would soon hug their grandchildren for the first time in a year. They were waiting the necessary 2 weeks post-second dose to visit with masks. This note and others like it remind us of how important this work is and exactly why we're doing it. As I've said before, the health department is just one of many receiving and providing vaccines in our county. Currently, our health department receives about 10% of the supply of vaccines arriving in Allegheny County. To date, across all of our sites, all of our county health department sites combined, we've given more than 42,000 doses of vaccine. In addition to larger sites, we're vaccinating residents of senior living facilities, starting with those in the housing authority buildings. This work has really been off to a great start. There are about 170 subsidized senior living facilities in Allegheny County. By the end of next week, we will have vaccinated about 150 residents in communities from Clairton to Tarentum to Westview and beyond. And a number of other organizations have also joined this effort, amplifying the ability to reach people in our community. In addition, the health department has collaborated with organizations that have hosted community vaccination events, and our health department will continue to identify and support innovative strategies for reaching all of our residents. The supply of vaccine remains the limiting factor in all of this work, but this too seems to be improving. I'm pleased to report that as of Monday, our team is administering first doses of Pfizer vaccine in Castle Shannon, while we are giving second doses of the Moderna vaccine in Monroeville. Once available, we will also be prepared to administer the Johnson & Johnson vaccine. As I noted previously, we are adhering to the state's request to smooth appointments for second doses of Moderna vaccine. To date, we have successfully managed our supply and been able to provide every second dose within the CDC recommended guidelines of 28 to 42 days post-Moderna vaccine, post-first dose. To those who've waited patiently for their second dose, I thank you. Please know we are absolutely committed to ensuring that all second doses fall within the guidelines. I want to switch gears just for a moment and talk about influenza. As I said a few times this year, we have had a very quiet 2020 to 21 flu season. As of the end of February, there were 197 confirmed cases of influenza in the county. Unfortunately, we recently learned that there was one death from flu this year, a person in their 70s who died in early November. This death had not been entered into our state tracking system, and so our team only just learned of it while reviewing death certificates. I apologize for the lateness of this notification, and I want to express my sympathy to the friends and family of this individual. Even a single death is one too many. It's worth noting that in a typical year, we'll have about 100 flu-related deaths in our county. This speaks to the importance of the COVID mitigation strategies to reduce the spread of other respiratory infections, not just COVID-19. Just a few quick reminders. Testing continues to be a really important component of our ability to hold the virus and to be part of our COVID response. And our testing site and mobile units remain active and out in the community to perform tests as needed. So please remember to get tested if you have symptoms or you're a close contact of a case. As the weather becomes warmer, we will be able to spend more time outdoors, which is great for our health, but it's also, again, we know the virus does not spread as effectively or as efficiently outside, so that's also good. Nonetheless, I want to remind you all to be safe while you're also having fun. Please continue to wear your masks, wash your hands, remain physically distant. And this is true even if you've had the COVID vaccine. So thank you for your time, and please stay safe and be kind. I'm happy to answer questions.
The first question we have is from WTAE. This week, the governor eased some restrictions, allowing for some fans at Penguins games and likely Pirates games. What is your reaction to that decision?
I agree that with the governor's ruling come out this week, I think he made a few, I'll call them easings. We haven't totally opened things up, but by a few percentages, increasing the gatherings that can occur indoors, as well as the gatherings that can occur outdoors. The Penguins have 12 games, I think, in the month of March. And then, of course, baseball season will be starting in another month. You know, we kind of went through this last year with the Steelers, and I will give the Steelers a lot of credit. As I watched the games on TV, I always saw people wearing their masks and wearing their masks properly. The fans, the coaches, etc., the training staff. I watched the game last night, and the vast majority of the Penguin fans were wearing their masks, but there were a few that weren't. And I think we've got to make sure that these teams, both the Pirates and the Penguins, are vigilant. It's required to wear your mask. If you don't want to wear your mask, you shouldn't be going to the game. And I think if people take off their mask or wear their mask improperly, I think the ushers are going to have to remove them.
This next question is from the Pittsburgh Business Times. Has there been an improvement in terms of supply over just the last 2 weeks, and how has that helped the department's ability to increase or maintain vaccinations?
I would say that there has definitely been some increase in supply and information coming to us about our supply.
This next question is from the Tribune Review. Is there any comment on the governor's announcement today that teachers will start having priority for the Johnson & Johnson vaccine, and any predictions on how this will affect case levels in schools or the county as a whole?
This obviously has been a discussion that's gone on both nationally and statewide and even locally. We want to get kids back in school. We also know that schools have been operating safely. They've been wearing their masks, socially distancing, et cetera, doing all the mitigation strategies that our health experts have said. Some schools have remained not as open as they can. And we can do data on cases. We do data on hospitalizations. We do data on fatalities. We don't have data on the damage that being out of school for almost a whole year has done to our children. It's going to be something that we have learn about later on in a difficult way. So the importance of getting kids back to school, I think, is important. A lot of the decisions that have come out of both the state and the federal government, unfortunately, have been partisan. This is one area in which I give the governor a lot of credit. He put a task force together of Democrats and Republicans from the Senate and the House in Harrisburg, and they came to a conclusion that this was the best way to operate. With a new dose of vaccines coming on board, the J&J vaccine, those vaccines will be set aside for the teachers and for folks in schools. What's good about that is it doesn't take away the folks that are going to be getting Moderna and Pfizer, and they stated that in the release that they had today. So it's, I understand where some people, think they might disagree with the decision. But again, moving forward, this is going to allow our schools to fully open up, get our kids back at the school, and get us, again, towards a normalization.
This next question relates to the variants. Could you tell us what percentage of positive tests are being further tested for variants in Allegheny County?
So we know that the number of tests being sent for variant is still relatively low. I would refer you really to the state, because much of this work is being done through the state Department of Health, and they would have the numbers to answer that question.
This next question is from Pittsburgh Business Times. Could you talk a little bit about what the impact of smoothing vaccinations has been on the ability of the health department or others to reach diverse communities and communities of color?
So we have been working with the state to smooth out our doses to really reduce that sort of bulge in demand for second doses. And again, we've been able to get people in for their under 42 days or up to 42 days. The other thing I think people should know is that the state put out guidance that asks anybody who's receiving COVID vaccine that are first doses, that they get out 80% within 7 days. And to do this optimally, you need lots of advance warning so you can plan events and schedule them. It's a little harder when we don't have a lot of advance warning. So we continue to work with the state on our distribution. But for the beginning, the health department really has been focused on filling gaps in areas where there haven't been vaccine, which is why we've been focusing on the senior living facilities. And we continue to pursue as many innovative strategies as possible, and we'll be able to do that even more and more to reach all communities effectively once we have a more steady supply and more predictability in that supply of doses. And when we get a little bit more data from the state about where currently the doses have been given in our community.
This next question is from the Tribune Review. The Archdiocese of New Orleans and the U.S. Conference of Catholic Bishops urged Catholics to avoid the Johnson & Johnson vaccine because it used fetal cells derived from an abortion that occurred in the 1970s. Do you have any reaction to that?
Well, everyone's going to have to make decisions about how they want to get the vaccine, assuming they're eligible at a certain time frame, whether they're 1A, 1B. I'm just going to read what the governor and the bipartisan commission had said today, that the Johnson & Johnson vaccine provides us with a unique opportunity to offer the vaccine to teachers. This will speed up children returning to the classroom full time while not taking away doses from our senior citizens and those with health issues in phase 1A. So again, people are going to make decisions on which line they want to get in. Some people might be upset that the teachers are getting special treatment to be able to get exclusively to the J&J without others getting it. So we'll follow the governor's guidelines on this, on what has come out by that bipartisan commission. We want to get people, again, as healthy as they can, as quickly as they can. And the biggest thing what Dr. Bogan and her team have done, have prioritized those over the age of 65, because 90% of the people who have succumbed to this disease are over the age of 65.
This final question from WTAE is for both of you. In less than 2 weeks, we'll be marking a year since the first COVID-19 cases were reported in Western Pennsylvania. Can you offer any reflections on the past year of the pandemic and any thoughts on what you expect to see in the year ahead?
Well, let me start by thanking Dr. Bogan for taking this job a year ago. I don't know that any of us knew what, and she certainly didn't, what she would be walking into. The dedication that she has provided and then provided throughout the health department and across the county has been just a great example. And the fact that we've got so many great healthcare professionals in this region, it's been part of our culture for decades, going back to the Salk vaccine and even before that. And I think the folks around here, we listen to our healthcare professionals because they give us good advice. They do things to keep us healthy. The one thing, and I mentioned it earlier, is there were a couple of times during this last year in which we as a community relaxed. The one time was in early June when we were entered into the green phase, and there was a lot of activity that probably shouldn't have happened. And we saw our cases go up again. And then again, Dr. Bogan and her team came in and put some restrictions in place. We got the numbers down again. People were getting healthier again. And again, we relaxed. And that happened in October and November. And we saw the results of that. And again, I mentioned it earlier, I hope those are lessons learned, that we're so close, we're a couple months away, that we keep those lessons in mind and continue to wear our masks, keep our distancing, and do all the things we know what to do. Dr. Bogan?
Yes, thank you. Tomorrow will be a year from the time I was sworn in as the health director. And on the 15th will be, I think, a year since I started my position here. I certainly have learned a ton personally, but my reflections are really that I'm very proud of the work that the health department has done. We have pushed our staff to work long hours, to do things that they've never had to do before. It's just been an incredible team effort. And I hear in my ear a lot Jen Liptak, who's the chief of staff for our county executive, saying the health department is not an island, Dr. Bogan. We have resources here. And I hear that all the time, and that has been true to the word. Our county government has stepped up and helped in every part of the pandemic, and the health department can't do this alone. We needed help from Department of Human Services, from our IT department, from every part. We're working with our housing authority. It could just go on and on about how collaborative. And we've also had help from every not-for-profit in this community, from our healthcare organizations. It really has been a county-wide response. And I think that when I look back, that is what I'm most pleased about having taken this job. I've gotten the opportunity to work with incredible people across all sectors of our government. So I have a lot more to say on that, but I think that's really probably when I look back about my experience in this year, has really just how proud I am of our community, of everybody coming together and working really to address the issues from every aspect of the pandemic, impacted people's lives in so many ways. And the health department was one piece, but we really were a community in addressing the pandemic. So I thank everyone for their help and their partnership and their collaboration. I can't tell you how many times across this past year people said, just tell me how I can help. How can I help? And they did, and they offered with generous help. So thank you all.
That was the final question. If there are any closing remarks.
Yes, and again, we're getting close, and we're going to see more and more vaccines coming available, not just the J&J and Moderna and Pfizer. There's other ones that are in the pipeline maybe. But we also know that those companies, those drug companies, are ramping up their production. So we want to get as many people vaccinated as we can. Dr. Bogan said it very well. The level of cooperation of so many people who want to help and have been willing to help it's just great to see. So very proud of the work of everybody, and let's stay safe, and we'll